Hello, I'm Dr. Johnson. I am your host. If you want to share this screen, just press the button at the bottom of the screen. And if you have a friend you want to tag, just want to hear this lecture, just tag them. So waiting on some people to join us. Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the Gorgeous RX system. I help women who want to have even and clear skin tone with increased confidence. If that's you, follow me on facebook.com/Dr. Sonia Johnson, DrSonyaJohnson. Today we're going to talk about bleaching creams. Number one is your Hydroquinones, and a lot of people have heard of them, I'm sure. It's a chemical that actually lightens the skin if you apply it regularly. So normally you apply it twice a day. And it takes, I give it up to 3 months, definitely no longer than 6. But the problem is you want to make sure you don't overdo it. And what I mean by that is you want to use the cream twice a day only on the spot. You don't need to put it on all over, but only on the bleach or lighten that area. And you use it twice a day. And I recommend using a Q-tip so you will not you won't get it on your normal skin tone. The problem with hydroquinones is not only that if you don't stop it in time, it can get lighter than your normal, the surrounding areas or the areas that had not been treated, but also it does it blotchy. So even though you put it on evenly, it does not lighten it up evenly. So it causes more blotchiness, but it does lighten the area. So this is one of your higher concentration creams, or in its own right, regardless of the percentage, is one of the bleaching creams out there. So that's something to consider. Now, because of the fact that in large quantities, large amounts over the majority of your body and for a long period of time, it can cause ochronosis, which is when you have a slate gray appearance of your skin, because after using it for a long period of time, it causes more discoloration. But the fact that it has been linked to cancer, again, large quantities. I have not seen a person use large quantities, okay, getting a cancer per se. But because of that stigma, a lot of people don't want to use it, and they rather use non-hydroquinone containing bleaching creams. But regardless, again, I have not seen that personally. Because my patients don't use it or clients don't use it that long, or we do other things to get that area to lighten up. It's not doing its job fast enough, okay? So with the bleaching creams, hydroquinone, again, it works very well. It's one of, I guess, like I said, one of the better bleaching creams out there. It comes in different percentages, but because of the risk factors that I just mentioned, mainly the link to cancer, the United States have decided to only allow the 2% and up to 3% really to be sold over the counter. And anything higher than 3%, 4%, up to 12% is a prescription. So pharmacies normally your retail pharmacy normally carry the 4%, and that is twice a day. The higher concentrations, 5 or 6%, is usually compounded at a apothecary pharmacy. And again, some people have different things mixed with it, such as vitamin C or retinol, retin A, so it can work better. Now, when you get into the higher concentrations of the hydroquinone by itself, you do have to worry about irritation, okay? So just keep that in mind. And a lot of times when you get a higher concentration of hydroquinone, a lot of doctors mix it with a mild steroid cream, so to counter-effect the irritation, and therefore you can tolerate it better without any problems, okay? So with that in mind, like I said, hydroquinones work very well, extremely well. You just want to make sure when you put it on twice a day, or if you have the retin A mixed with it or any type of retinol mixed with it, you only use it at night. But after you finish putting it on, after a couple of months have gone by, you want to make sure you stop it when your skin is a tad darker. That area is a tad darker than your normal skin, because once you stop, it's still working for up to another month, okay? Now, besides the hydroquinone by itself, You can get it mixed with other things like I mentioned. You can see vitamin C, K, E mixed with it, other vitamins, or you can see retinol mixed with it. Prescription-wise, Retin-A, again, along with a mild mid-strength steroid or a lower-strength steroid to counter-effect irritation. I still give it 3 to 6 months. For my clients, when the hydroquinone is not working, after 3 to 6 months, then we go on to chemical pills along with the hydroquinones, and that tends to do the job. Now, keep in mind, hydroquinones are good for definitely discoloration. Let's say you get acne or a rash and it clears, but it leaves this discoloration. It takes care of that, takes care of melasma, as lentigos, age spots. So with the those areas, and especially with the discoloration, what it does, it blocks the production of melon. So as long as you're using it, it's taking care of that for you, and it's lightening the area. And as your skin exfoliate, that discoloration is gone. So therefore, that is how it works. Another thing you wanted to consider with the bleaching creams before you even decide to use it, one thing that is really evident is more in the ethnic skin is this discolorated spot I have that I want to bleach out. First of all, how did I get it? Is it due to increased pigmentation, or is it due to a bruise? And the reason why I say that is because with ethnic skin, if you have a bruise, you can't tell it. Sometimes you can because you have the discomfort there, or you was bleeding there and you're left with a bruise. However, in the case of acne or areas or rashes that cause your skin to swell, a bruise is actually a little leakage of red blood outside and underneath it's placed underneath the skin, so it leaks outside of the blood vessel, and you might not even notice it really, but your body reabsorbs that. However, the iron stain in our red blood cells, there's iron, and when your body reabsorbs the red blood cells, sometimes the iron stays behind. And what it does, it causes a discoloration of the skin. Now, for your Caucasian skin, you can see it. You can see, especially around the legs, you see this like a honeycomb color or champagne-like color of the skin, what we call it honeycomb, like a golden brownish color. And that is iron stain. In ethnic skin, darker skin complexion people, you won't notice that. You just notice discoloration. So you're thinking, oh, I got this dark spot, the bleaching cream should work. Well, only way you're going to know if it's going to work or not, to go away, the light spot is going to lighten up if you use the bleaching cream. So what I tell my patients is, hey, you had acne, some of those spots are going to lighten up, some may not. And the reason being, because when you have acne, the area has swollen up a little bit. Heaven forbid you actually picked at it, trying to get rid of the acne zit. And it causes this bruising effect or leakage of red blood cells. Your body absorbed it, but it left the iron stain behind. Because it looked the same as a discolorated spot that normally works or goes away with bleaching creams, then you really need to use the bleaching cream to see will it work and give it ample time, 3 to 6 months. After that time, if that discolorated spot is still there, you're not dealing with the discoloration. You're actually dealing with iron stain, and therefore there's nothing for it. Meaning that discolorated spot is going to stay. It never goes away. So that's another reason why if you have acne or rashes, you just don't want to pick at it. You want to leave it alone and try to get it under control fast before it causes stretching of the skin, a little bruise there that can leave discoloration that you cannot resolve, okay? So that's the caveat you want to take home message is, before you partake in it, just have an endpoint with the bleaching creams. You shouldn't be using it on the same area for years. I give it 3 to 6 months. If it's not working, you need to add something to it, chemical peels or Retin-A. And if you've already done that and it's still there, abort. Stop. It's not going to go away. So just keep that in mind. Otherwise, hydroquinone, I like it. I think it works well for a lot of my clients and patients. And I do recommend it. I do prescribe it for the ones who want a higher concentration than the 3% that is over the counter. And other than that, tomorrow, we're going to talk about some other options for you to lighten up your discolorated spots. Any questions? Okay, thank you again for joining me tonight. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist, and creator of the Gorgeous RX system. I help women who want to have even and clear skin tone with increased confidence. If that's you, follow me on facebook.com/Dr. Sonia Johnson. DrSonyaJohnson. Take care.